Currently we are engaging in a study that looks at the effects of yoga in improving motor function in Parkinson's disease. With respect to Parkinson's disease, it's a disease that progresses and we can't stop the progression, and there is really no medication that can stop the progression. What we know is that they have problems with what you call proprioception, which is really the bodily perception. So the sense of body awareness, it may decline or may be compromised. And so then you have yoga as a therapy that potentially enhances body awareness. And the question, does this work? But there's a lot of accumulating evidence that some forms of exercise, physical exercise, are beneficial. The question then is, what type of exercises and what are the effects of it and what are the long-term effects of it? And this is where this yoga study will fit in. So in Parkinson's disease, what we understand is they may have balance problems, may have gait problems, and part of this may be due to the fact that they also have an impaired sense of bodily perception. Yoga, of course, is supposed to help with this, and the notion would be, if you are undergoing an intensive type of yoga training, will you see improvements in balance and gait function in these patients. People go through an intensive 6 weeks yoga therapy, and we basically do the assessment. We'll do the biomechanical, we're looking at gait, at postural stability, balance, ability, and get an understanding, they are moving differently after this, and how do they move? Do they have better balance? Is their gait altered? Has it improved? Those are the kind of things that we'll do in this study. So here it is really, it's like, do you as a patient, you go through these 6 weeks, will you improve? To what extent? And will you not? And this, of course, is what you would call a phase 1 clinical trial. So this is an initial study to look at efficacy of this type of intervention to get an understanding. Could this become a therapeutic intervention in the future if this has been successful? You see these patients day in and out. They're all humans, and they try to deal with this. They try to understand, and they're trying to improve, and here you are, and you're trying to understand what happened to this person. And not that this clinical research may not help exactly this particular patient. So you have to have a long-term or longer-term view, but by seeing this and measuring this in several patients, eventually a picture emerges of what are some of the underlying causes.